Good afternoon, everyone. This is David Anderson. On behalf of the CEO Innovators Roundtable, BDC Advisors, Foley & Lardner, and AMN Healthcare, I want to welcome you all to the second webinar in our series on COVID-era innovation opportunities. How COVID is changing the way large self-insured employers provide healthcare to their employees and dependents. That's the topic for today. My name is Dave Anderson. I'm a senior advisor with BDC Advisors and a longtime national healthcare consultant. BDC Advisors is a strategic consulting firm, and we're doing a lot of work these days with health systems and health plans that are navigating the new normal world of COVID-19 era healthcare. We're learning as we go, like everyone else, and this webinar will hopefully give us an opportunity to understand better how large employers are responding to COVID-19, especially where it comes to worksite healthcare, which is a major topic here. Why is the positioning of self-insured employers important? About 60% of America's workers are covered by self-insured employers. Their health benefits are covered. So it's a large majority of the country, either by their employers, labor unions, or other self-insured arrangements. And ERISA gives employers and other plan owners considerable flexibility to organize their care. So as a consequence, we've seen a lot of innovation in the self-insured employer space around ambulatory care and so forth. And they've been leading edge innovators in managing and delivering healthcare in many ways. That makes them bellwethers, essentially, for future healthcare trends in the rest of the economy. My guests today on this webinar are Dr. Jamie Doucette, who's president of Premise Health, the nation's leading worksite care provider, and Pam Ventura, who's head of benefits for Capital One. And I'm going to let Jamie and Pam introduce themselves in a minute, and we'll get right into the topic. The webinar will last about 45 minutes. We're not going to take the whole hour, so you have time to refill your coffee or finish your lunch, depending on where you are, before your next appointment. During the webinar, we'll be taking questions from all participants, from all of you. You can submit questions via the Q&A button at the bottom of your screen, and I will pass them on to Jamie and Pam. We will be recording this webinar and making it available to CEO Innovators Roundtable invitees who couldn't attend in person. This is not a public discussion, but it is going to be on a secure YouTube website for invitees who are invited to join us. So with that, let me turn it over to Jamie. And Jamie, maybe you can tell us a little bit about yourself and a little bit about Premise Health.
Great. Thanks, Dave. Welcome, everybody. Thanks for spending the time. Happy to be here. Very grateful to be here, and certainly don't hesitate to send those questions in. Happy to be responsive. Jamie Doucette, President, Premise Health. At Premise, we operate health centers, fitness centers, pharmacies, mostly for the Fortune 500, Fortune 1000. We've got about 850 centers, serve about 11 million lives in 45 states and Guam, and deliver those services through an employed provider team in both a digital and a physical environment. And we'll get into some of the digital specifics a little bit later. But most of our physical centers are either on-site, on campus, serving predominantly the employees of our clients, or near site in the community, serving both employees and dependents. Most of our value driven through our core products of primary care, pharmacy, fitness, occupational health, wellness, and certainly behavioral health as of late. But we do deliver 31 products to the marketplace. With that, I will turn it over to Pam to provide her own introduction.
Hi there, I'm Pam Ventura, and as Dave said, I'm the head of benefits for Capital One. So my team has responsibility not just for the health plan and the area of focus for today's conversation, but also the other benefits we offer to our associates. And as we go through this conversation, I'm going to talk a bit about how those other benefits have emerged as really important, particularly in the area of things like well-being and the support that we can provide to our associates in that area. So Capital One, for purposes of today's discussion, I'm going to focus on our U.S.-based population. We have about 45,000 U.S.-based associates. Most are in around a dozen large people centers across the country. Prior to this pandemic, we only had about a 4% work from home population. So as we go through the discussion, I'll share a little bit about how that's changed for us, the posture that we're in right now. As you can imagine, it's very different than 4% people working from home, as you can tell from my own background. We cover about a little over 80,000 associates in our health plan and their dependents and family members. As Dave said, it's been a very interesting time as a large self-insured employer. So I'm looking forward to sharing some of that with you. And again, open to questions as you might have them.
Great. Well, thank you very much, Jamie and Pam. So let's just start off with, I'll ask a few questions and please participant fire away. Pam, if you just look at your industry, your company, and your perspective on self-insured large employers, how are they adapting their business models to COVID-19? And how do you expect that to play out over time? And in particular, how much of this is temporary and how much of this you see is permanent? Sure.
So as I shared, as I was introducing myself and sharing a little bit about Capital One, prior to this pandemic, we were about 4% of our associates working from home. In a short period of time, about 10 days, we went from that to now we're in a virtual posture for all of our associates, except for about 1,200 associates who are working in one of our bank branches or our Capital One Cafe or have something about their job that has to be done in a brick and mortar fashion. So a huge shift and a huge pivot. Right now, we are really committed to a slow, steady, and staggered return to the workplace. So we haven't declared a time when associates will be returning to our workplaces. And we're still working through what that looks like and what impacts there could be, if any, on a future strategy. I will say, as you follow this news externally, we're hearing more and more of large companies, especially in the tech space, making declarations about their future workforce posture. And we're watching those things really closely as we think about our talent strategy. One thing about Capital One that's a bit unique is we have a really diverse workforce in terms of the kind of roles that are performed. We have a large section of our workforce that is servicing our customers directly. So think of a traditional call center agent. But then we do have a really large tech organization too, and it runs the gamut from every kind of job you can imagine. So that presents different and unique challenges as you think about a footprint strategy and even a return to the workplace.
And you're talking about a slow, staggered return. Where do you think you're going to end up in 2 years? Let's assume that we get a vaccine and COVID goes away next year at some point. How much change, permanent change, do you think there'll be?
Dave, we don't know the answers to that yet. That's the thing that's so challenging. And so what makes that particularly challenging from a employee benefits position is, as you've talked about, just the delivery of health services to our associates. We do have we have 10 on-site health centers with premise. So I'm happy to be here with Jamie today. So we service right now around 30,000 of our associates have access to those on-site centers. So the large majority of our U.S.-based workforce has access to an on-site center. So how that will change over time is still a question. Beyond just that kind of delivery of on-site services and amenities, I think there's a really big question out there on how will this pandemic shape or change employees' expectations of an employer and what they believe is important in an employment value proposition. So, there are sort of fundamental shifts in what our associates need right now. The sense of safety and security is really, really important to people. How they're addressing and dealing with disruptions in not just the way they receive their health care, but actually how they care for their families more broadly. So things like disruptions to childcare, disruptions to the school environment, are all really top of mind for our associates. We made some sort of immediate moves to ensure our associates had access to the healthcare coverage they needed. We are covering telemedicine visits at 100%, actually, regardless of the type of visit. So the way our health plan works, we cover primary care visits at 100%. So in-office primary care visits, even pre-COVID, were covered at 100%. We knew we had to enable associates to continue that primary care relationship. And we also really wanted associates to continue their relationships with the specialty providers that address particular, conditions that they have. And so we have for 2020, we have gone to free telemedicine visits, regardless of the type. For 2021, we're looking to continue to have free PCP care, whether it's delivered in a brick and mortar facility or in a telemedicine arrangement. And we'll go back to our normal cost share arrangements for specialty visits. So some moves like that we know need to stick, right? So we know that this move to a virtual healthcare delivery in some way will stick. And so we're thinking about our plan designs with that in mind.
Well, that's actually a good sort of segue into another issue directly related to healthcare, which is how do you see, both of you, how do you see these utilization patterns changing and expectations? And I think you brought up an interesting idea, Pam, that somehow the relationship between corporations and their employees at a very fundamental level may shift too. So, but how do you see utilization patterns and the changing in this environment? Are they going to be getting care more locally? Are they going to be getting care? Are they going to be still going to your worksite clinics, Jamie? What do you see happening?
Yeah, Dave, I think it's a great question. And echoing what Pam says, I think it's a bit unknown at this point. We deliver care both through the physical centers, but also through digital platforms, virtual care. Our virtual care philosophy is both a local philosophy, so care delivered by the provider that you might normally see at one of our centers, as well as a national kind of 24/7, 50-state philosophy, anytime, anywhere care with a dedicated physician team. At the peak in about mid-April, 83% of our encounters were delivered through that virtual care environment. We're now back down around 50-50 at this point. We are seeing wide variation based on industry and based on geography, where some states have been quicker to open, or some industries had been deemed essential and had been operating per usual throughout the entire pandemic. We're seeing those visits in the physical centers approach, what historical norms might have been. But were those folks like Capital One still predominantly at home or a work from home or work remote environment, almost 100% of those visits are in a digital or virtual care environment. So we are seeing a wide spectrum of utilization patterns. Net, kind of 2 years from now, what does normal look like? Our best guess is that the digital versus physical equilibrium resettles in a bit of a different spot. Best guess right now is call it 25% of visits being executed in a virtual or digital environment. But again, that's just, crystal ball type philosophy there, and no one's got the perfect crystal ball. But certainly, we are seeing members become much more familiar and much more comfortable with engaging a provider in a virtual environment, much like my parents, much more comfortable engaging the grandkids in FaceTime or a digital environment at this point. You know, the pandemic was a forcing function to drive that comfort level. And so we do anticipate the new equilibrium of digital engagement being quite a bit higher than historical levels.
And how would you separate that? Is there a difference between primary care and specialty care on that dimension?
It's a great question. What we are finding across our product portfolio is there is digital or virtual applicability for almost every product. The degree of applicability varies widely. Primary care, very applicable. Something like physical therapy has some applicability, but not enormous applicability. And I would argue that for the medical subspecialties or medical specialties, there's going to be much wider applicability than the surgical specialties. Yeah. And so you're going to see a specialty by specialty variance, I think.
Yeah, and I would add to that, Jamie. I think the area that's been really interesting to watch has been mental health services. So we through Premise, we have mental health services at each of our on-site locations. We actually opened one location during this pandemic in a virtual first posture about a little over a month ago, and we've seen really good uptake. We've seen the penetration of how many of our associates who are eligible for those centers are continuing to use them to be almost the same as pre-COVID levels. So no real disruption because of the virtual shift, which is interesting. But in both our relationship with Premise and then also just in our medical plan, the utilization of health services for mental health providers is leading the pack. And that's just an interesting shift that I think is important because maybe that's a way in which we'll begin to address some of the access issues in that space.
Yeah, I think I would echo that. Our greatest demanded virtual product right now is behavioral or mental health, by a landslide. I think there's an additional degree of comfort being in your own home or being in a private setting to engage with those providers, and we're seeing material uptick in those visits and those encounters.
Yeah.
And then I think that there's other kind of anomalies happening right now, right? And any, from a self-insured employer standpoint, obviously one of the things we pay a lot of attention to is what do we think, what are our actual projections for our costs for the year? And so early on in this, it was, a lot of anybody's guess. And we had models that spanned from a really high scenario to a really low scenario. And what quickly emerged for 2020 was the costs that were driven by actual COVID-19 related care were not on the high end, which was great news for our associate base and their families. But the offsetting savings associated with avoided care and the shutdown of all non-emergent care for a period of time in our locations in particular just had a huge impact on 2020 costs. So one of the things that we're really paying attention to for 2021 from a cost trajectory standpoint is, if we're still dealing with COVID-related expenses, which unfortunately, best estimate is we will be, will we still see that offset in really reduced amount of care? And our expectation right now is that's not going to be true. Things are starting to moderate back to normal. There's then another wild card in this for self-insured plans of what's the downstream cost of this period of avoided care? Are we going to see an uptick in acuity? Or what happens from a disease burden standpoint in our populations? And those things are all really top of mind for us, and I'm sure for other self-insured employers.
It's interesting. I think from the standpoint, we work a lot with providers, and from the provider standpoint, there's huge diversity around the country in terms of how these elective cases have come back. In some places, like South Florida, for example, well, particularly the west coast of Florida, Orlando, and those areas, it's like they're up 110% of normal. In other words, they're already caught up and actually doing more. And in other states, they're still 70%, 60% less. I assume that you're seeing that in your employee population too, Ben.
Yes.
Are you?
Yeah. Yes, we are. And we just have where we are located and concentrated is skewed more towards areas where the elective care is not coming back quite as quickly. And then there's some other just anomalies, right? Like our dental care expenses are really low. And, we know that dental care is a really important preventative health measure. It's often a place that something gets picked up first. So what is the impact of that long term or in the near term for the next couple of years will be really interesting.
Yeah. Jamie, do you have a perspective on that as well? Just variation
I think
across the country?
So as a large self-funded employer ourselves at Premise, would echo Pam, although, our corporate offices, corporate headquarters located in the Southeast in Nashville, and we've actually seen a July, August spike. So that pent-up demand actually hit us towards the end of Q or beginning of Q2. And we've now kind of normalized in September, or preliminary results suggest that. Where we are focused, as Pam suggested, is kind of our hospitals are really going to have to recoup some of that revenue lost by increasing prices to the self-funded plan or self-funded employer going into 21. And I think, if we hope for the best, plan for the worst, the planning suggests that, yes, we're going to see some of those price increases come through. And how do we proactively plan and prepare to manage and navigate kind of that environment and that dynamic is where we're focused on as we get into that planning phase.
Yeah, and Jamie, we're in a similar situation where we're starting to see by about August things moderate back, and we're actually expecting the fall we could go above typical rates of care just with some of the pent up demand.
Yep, agree.
One of our participants has asked an interesting question. What about home-based care? Are you seeing either of you an appetite for more home-based care? Is that part of your projected thinking?
Yeah, we haven't. We don't have any particular projections around home-based care. I mean, I think there's this underlying question of, which Jamie alluded to, of like how big of a shift from a traditional brick and mortar setting does this put in motion? We all know it's at least created more traction in telemedicine, right? But does it actually disrupt the way brick and mortar healthcare centers are used and push consumers to more digital first solutions and interventions and kind of a staggered approach where brick and mortar is reserved for really highly complex care? And I think those things are all the big wild card that none of us know yet. And I would put, a move towards significantly more home-based care in that camp of a little bit bigger shift. I don't know, Jamie, what your perspective on that is.
Yeah, I think it's a very interesting question. I think we were seeing a bit of an uptick in home-based demand, certainly in the Medicare, MA, managed Medicaid, dual eligible populations. There are several companies out there that have grown quite significantly in the last 3 to 5 years. In the commercial space, we've seen a little bit of uptick in demand, but ironically enough, digital demand or virtual demand, far outpaced the home-based conversations. I think in a pandemic, people were concerned about bursting their bubble with a provider coming into the house or into their bubble, And so, Reflex was access care through a virtual means, which was quite a comfortable approach. And so I do think the virtual physical balance might shift, but that we are not seeing kind of the home-based care conversations pick up anywhere close to the virtual or digital conversations.
What about just in terms of your members, consumers, what about more concern about health and well-being? Do you think that this pandemic could have any positive effects on people's thinking about their health? I mean, certainly one of the things we know from the pandemic is that if you got risk factors, you're in deep trouble. And if you don't, you're not. So
right. Yeah, I actually thought you were going to a slightly different place around just well-being and particularly emotional well-being and how companies are addressing that. And I will say, I do think this period of time has created a significant shift in a company's ability to begin to really break down the stigma related to mental health issues. So we saw early on, we use a lot of customer back and human-centered design approach to the way we build our benefit programs. And so we've spent, after we got through the initial kind of crisis of we have to get everyone working from home, we have to address safety and security issues and kind of the core access to healthcare services, we began getting insights from our associates pretty regularly on what they needed and what they were experiencing. And stress, anxiety, all those issues that we're all reading about in the news were certainly true for our associates for a variety of reasons. Fear of about their loved ones, stress in navigating being a working parent in this new, very different environment, and so we've jumped on that moment to really try to address, break down the stigma associated with talking about emotional well-being issues in the workplace, from things like giving our managers and our people leaders toolkits for how to have those conversations and how to ground them in the priorities that are being set at work and the really understanding what your employee needs in this time. To things like a storytelling campaign. We did a storytelling campaign, and are still doing it, called Beautifully Human. And we have a series of videos or written stories that associates are sharing about the different challenges they're experiencing either now or even in the past. And it's been super powerful to allow associates to just say, hey, I'm struggling with something. And so I do think that's one of those it was a work that we've been focused on for some time, but it was a bit of an igniter to be able to address it during this time.
That's fascinating. That's fascinating. I don't think I would have predicted that, but that's fascinating. Good, Pam, just sticking on sort of your business for a minute. How are you thinking differently about health benefits, given all these trends and all the uncertainty involved? How are you thinking about plan design changes, provider network changes, contracting relationships? How do you think about the impact of COVID-19 on that?
Yeah, so I think there's a couple things. From a core plan design change, addressing how we'd handle telehealth visits was important. So we've done that for 2021. And then really, as I said earlier, just making sure we understand what's happening from a cost trajectory standpoint continues to be critically important. So we don't have any other kind of immediate reactions for 2021 in the space of our core health plan design. I'll answer your question like a little differently than just core health plan design and focus more on the way that an employer delivers their health plan to associates. I do think this experience has magnified the importance of really smart, personalized digital tools. So in a sea of really complicated communications to our associates about things that were shifting in the way they do their work, or just kind of an overwhelming amount of information, it's become very important for an employer to be able to tailor messages to a person based on what they need and what they're experiencing in their lives. And that's been something that's, not new. There's a lot of players in that space, but I think this has magnified the need for really smart, personalized digital tools. And so we are on that path, and think it will be a real value add for our associates so they can get to what they need. Because it could be, for a particular person, it may be something in the health plan, but it may actually be something else that we offer them as part of their employment package that would most benefit them.
So that reminds me of sort of disease management programs, diabetes education, things like that. Is that what you're talking about, or is it different?
Yeah, really, what I'm talking about are smart digital tools that identify for a person the highest order need that they have. So for a diabetic, it very well might be something about their engagement in a condition care program or compliance with some sort of recommended screening. But for another person, it actually might be, they're experiencing some disruption in their childcare services. And so an employer needs to be able to serve up to them information about the support that can be offered in that space. And like a third person, it may actually be something around their financial well-being and what's happening for them in their finances that is most critical for them to address. So really being able to get away from we have a whole suite of things that we can offer to you, but you got to find them, to we know what things you need and we can give them to you when you need them.
That's a pretty fascinating role for an employer, to really try to wrap your arms and give people tools to help all these different benefit related, not necessarily health related, but benefit related. That would presumably have, good impacts on productivity, absenteeism, all these things that are important.
Correct. And when you think about,
absenteeism.
Yeah, I think one of the hardest things for an employer, and this plays out in the health plan, is communicating information to an associate, getting them to act, right, and engage in the behavior change that we're trying to instill. And the first part of it, just getting them to hear the message, is really hard, and then getting them to act is the second hard thing. And so the focus on how we leverage digital solutions in order to get the message across and the right message across, I think has really been magnified as companies have navigated these last several months.
That's fascinating. Should we shift to talking a little bit about worksite healthcare, Jamie, and kind of how you see your business evolving in response here? I mean,
Sure.
You mentioned already the shift to virtual, and that's obviously a big piece. How are you? Essentially, your differentiator from any other medical group is that you were on worksite, and now maybe the worksites aren't as important as they were. So how does that change your business?
Yeah, fair question. I would suggest our differentiator is not necessarily the physical location on site, but our specific alignment with the ultimate payer. Community provider groups, hospital systems, still predominantly operating in a fee-for-service environment, which runs exactly counter to the incentive of someone like insure. So alignment, a critical piece to our business model. We've been value-based since inception. But relative to your ask around how the business model or nature of the business is shifting, I would categorize it into three buckets: access, product, and the broader ecosystem. On the access side, you pointed out, the majority of our centers are physically located on premise or on campus. We are seeing an uptick in our near-site presence, so the development of near-site networks in specific metropolitan areas to better serve either a work-from-home population